Okay, good afternoon, everyone. Thank you so much for joining us today. We're really excited to have you all for this conversation. My name is Emma Kornetsky, and I'm an assistant director at the Government Performance Lab, housed at the Taubman Center for State and Local Government at the Harvard Kennedy School. I lead our portfolio of work focused on homelessness prevention, and I'm excited to bring you into this conversation that we have been having. And also joined by our partners at the Initiative on Health and Homelessness, as well as the Joint Center on Housing Studies. To kick us off, it's my pleasure to introduce Jeff Liebman, a professor at the Harvard Kennedy School and the founder and director of the Government Performance Lab. Quick logistics is that our chat is closed, but we have a Q&A box, so feel free to be asking questions throughout the webinar through the Q&A portion. And with that, I'll pass it to Jeff.
Thank you, Emma. As Emma said, I'm a professor here at the Kennedy School, and the Government Performance Lab is a research entity here at the Kennedy School that works with state and local governments to speed up progress on some of the nation's most challenging social issues. And for the past few years, we've been working with several jurisdictions to design and improve services that aim to prevent homelessness. And today we want to have a conversation with all of you about what the jurisdictions we have been working with have been trying and what we've been learning and where the state of the field is on this. I think the general orientation of this work is that we think we're never going to solve homelessness solely by getting better at providing more resources for rehousing people after they become homeless. We also need to reduce the number of people flowing into homelessness. And as you all know, most federal resources go to emergency response and rehousing. But during the pandemic, there was a large temporary infusion of resources toward emergency rental assistance. And this led us into a new era across the country where more jurisdictions started testing ways to keep people housed. And a lot of the jurisdictions have sustained various forms of emergency rental assistance or added new resources toward homelessness prevention and eviction since the pandemic. And I think it's fair to say that many of these programs were set up pretty quickly during the pandemic, and that we as a field are still learning about how well the various programs have been working, what's the best way to design and administer them. And particularly, I think about how to target preventative services toward people for whom the services will make the greatest impact on their likelihood of becoming homeless. So today, while we know more about prevention than ever before, there's still a lot of questions that remain. And so the Government Performance Lab is working to add more knowledge to the homeless prevention field, primarily around three main topics. First, understanding the pathways into homelessness so that we can figure out how to where to target resources upstream. Second, figuring out which interventions work best for different subpopulations. And third, supporting cities and counties and states in building out the management frameworks for the preventive resources that allow the resources to be targeted effectively. And among the work we've done is work with Detroit, San Francisco, and Alameda County. And today we're bringing together some of our collaborators in these communities to share how they think about prevention locally and how they layer various resources together. We're very excited to be here to have this conversation and to hear how Detroit and the Bay Area communities are tackling these challenges. And let me hand it back over to Emma.
Great. Thanks so much, Jeff. A quick note on what to expect. So I'm going to introduce our panelists quickly. We're then going to hear some brief presentations from them to give you an overview of how they approach homelessness prevention in their communities. We're then going to go to a few questions that we've prepared in advance, but then hopefully we're going to have plenty of time for questions from all of you. So please do add questions to the Q&A box as we go. We'll try to get to as many questions as we can, either through the chat or live. And with that, I have the pleasure of introducing our panelists today. So we are joined by Julie Schneider and Chelsea Neblett from the City of Detroit's Housing and Revitalization Department, HRD. Julie has served as director of the department since January 2021, overseeing the distribution of $45 million annually in federal affordable housing and community development funds and $300 million in one-time grants. Under her stewardship, Schneider has taken charge against displacement, shepherding HRD's efforts to keep thousands of Detroiters in their homes. 5,000 units of affordable housing have been preserved across the city since 2015, 1,200 new affordable units created, and there are another 1,200 under construction. Chelsea is the Chief of Housing Solutions and Supportive Services at HRD, managing both homeless response and homelessness prevention for the city, including oversight of the Detroit Housing Services Office, which you're going to hear about today. We are also joined by Irene Farnsworth, the Director of Regional Homelessness Prevention at All Home. All Home is a regional nonprofit that is a leader on homelessness prevention across the Bay Area. And Irene previously served as the Anti-Displacement Program Manager at the Bay Area Housing Finance Authority, where she launched a homelessness prevention program for seniors and led a regional study on evictions and tenant legal services. So these three women are all leading incredibly innovative work. They're willing to test new things, learn from what's working and what isn't. And I'm excited that you're going to get the chance to hear from them all today. So with that, I will hand it over to Irene to tell us a little bit about the work of All Home in the Bay Area.
Wonderful. Thank you. Well, I got my tech all set up here. Really pleased to be here. Thank you for having me. I'm here to talk about the 9-county Bay Area regional homelessness prevention work that All Home has been part of over the last 5 years. So All Home is a nonprofit advocacy organization where we do a lot of different things. We advocate for evidence-based policies to advance solutions to homelessness in the Bay Area and affordable housing. We are a partner to many different other organizations in the region. We convene, we fundraise, and we also grant funds to organizations and cities and counties to do this important work. So happy to share more if folks are interested another time. Over the last 5 or so years, so Jeff spoke to how these programs really started to get traction based on the funds available during the pandemic. All Home really became involved in trying to help cities and counties think about how to evolve their programs to really focus on preventing people at very high risk of homelessness from entering the homelessness system. So over the last 5 years, we have served over 24,000 people through our partnership programs. And you can see we now have either are currently operating programs or have in the past in every single county. We are launching in Marin this year. I'll just say Santa Clara County has a very well-established and really important homelessness prevention system that they run through Destination Home that All Homes model builds upon. Just want to really frame this as a continuum. So when we think about, I have a lot of conversations with people about prevention where we're talking about different things on the continuum, and it can seem like we're not talking about the same thing, but really we're just thinking about different points. So this graphic shows basically as we see the highest end risk on the left side of the slide can really go into homelessness diversion. If people are at very high risk of homelessness when they enter a system, they may actually become homeless and lose their housing before they're able to receive services. So the relationship with the homelessness response system is really important. One step further to the right, as the risk level goes down a little bit, we see targeted prevention. This is the space that All Home is mostly occupies, thinking about providing direct financial assistance and housing stabilization services to people who are at that cusp of entering the homelessness response system. I'm going to talk about the risk factors here, but you can see further down the continuum, we see eviction prevention and housing supports as being critical. A lot of folks we know need ongoing subsidies, they need rental assistance who may not be at imminent risk. Our targeted homelessness prevention work really centers on four services. So direct and flexible financial assistance. That could be for rent, rental arrears, move-in costs, utilities, and other expenses. This varies a little bit by county based on what counties are able and willing to fund. Housing stabilization services, employment connections, and legal assistance referrals. And a few kind of practices that we champion as part of the evidence base are to really prioritize the highest need households without requiring demonstration of sustainability. So this comes up a lot in our programs. Folks who feel like it can be very different to provide financial assistance to someone who appears to not be able to sustain their housing. But we've found, again, just speaking to what Jeff brought up at the beginning, trying to find where our funds can make the most difference. And what we've seen from early evaluations is that focusing on that highest risk population is where you see the most impact in terms of reducing risk of homelessness. Also, flexible online documentation. We really advocate for having flexible ways for folks to provide documentation, as that can be a barrier to receiving services. We don't expect 100% of the folks coming through this system to stay housed. If people are truly at risk of homelessness, the services we provide may not be sufficient. So that's another place to look to make if you are getting 100% housing stabilization, people might not actually be as high risk as we think. And then coordinating across that continuum that I just talked about. We've developed a common regional assessment tool that is used in all of the programs with some slight tweaks in depending on jurisdictions that centers on household factors like pregnancy, children, age, or recent life change, such as loss of a job or a spouse or another member of the family that was helping pay rent. Situational factors like arrest, chronic health conditions, disabling conditions, documentation status, and then housing and income. So, prior experience of homelessness is a really, really key factor in determining risk how high someone's risk will be. And then we also have a common platform that is used across counties. San Francisco does have their own platform, but other jurisdictions that I showed on that map across the counties and cities use this common online platform. It's really user friendly. It provides a way to do all of your documentation online, so people don't need to drive around or make their way public transit to provide documentation. And then on the back end, we're able to also see data from across programs, which is a really important thing in a place like the Bay Area where we have 9 different counties, 100 different cities, and it can be really hard to share information and have common back end support. And then, as you can see, those services are provided by nonprofit providers. So those are locally based so that people are often they don't necessarily think they're getting an all home or backs support. And I just want to call out our partner organization, Bay Area Community Services, that operates and holds this platform and does all of the tech backend for that. I'm going quickly. I think I'm at my 7-minute time. I'm going to answer any more questions in the chat, but I want to turn it over to Detroit to hear about your programs.
Good afternoon. Chelsea's going to share our slides. And so I'm, again, Julie Schneider. I'm the director of the City of Detroit's Housing and Revitalization Department. And so we are the department that both invests in housing and provides direct services to households experiencing housing instability. So Jeff was talking at the beginning, the outset of this discussion about the changes and disruptions in the housing and rental market that we experienced in the early days of the pandemic. And certainly that was not different in Detroit than it was in anywhere else where we saw changing eviction moratoriums from week to week or month to month. They were changing. And then we saw resources invested that, like many of you, we'd never seen the eviction prevention rental assistance dollars. And so coming out of the time where we had those eviction prevention dollars and some of the early pandemic relief dollars, we knew that despite the, I think, successful launch and successful management of those programs, that ongoing resources and ongoing assistance would be needed. And so while we didn't have in our case, we had hundreds of millions for eviction prevention. While we didn't have that, we did have other resources, and we had learned an awful lot during those early days of the pandemic about what types of services people were looking for, some of the circumstances that they were experiencing. And we had also really developed new relationships and much stronger relationships, especially with our court system, connections between both the city of Detroit, our court system, the state government. And while those connections existed before, they really came together in new ways at the beginning of the pandemic. And of course, that included many of our service providers that were key to those efforts. So coming out of those days, we really thought, well, how do we use the lessons that we've learned, and how do we start to apply that to new services that are really aimed at prevention? How do we help to reduce the flow of people into the homelessness system, or who are experiencing homelessness, or who are unsheltered in the city of Detroit? And while we're delivering those programs, what can we learn throughout the way so that we can continue to identify ways that we can improve delivery of those programs, improve their effectiveness, especially as we look at knowing that the American Rescue Plan Act resources, which has been extremely helpful for us after the eviction prevention dollars, how do we use those lessons learned to think about how do we continue to address prevention in the future? And so my colleague Chelsea Neblett is going to go through the details of some of the programs that we've launched and how we've administered them, especially as it relates to eviction prevention resources. Chelsea?
Thanks, Julie. So as Julie mentioned, since the launch of our Detroit Housing Resource Helpline, as well as our Detroit Housing Services Office, HRD, our Housing and Revitalization Department, and our system partners have been working to integrate resources into the helpline in order to respond to a continuum of residents' housing needs. So this discussion in terms of upstream resources is listed here in terms of proximity of residents, housing insecurity, and possible homelessness. Our goal is to help connect residents and stabilize households more upstream as early as possible prior to the need for homelessness and emergency services. These resources become more intensive and also more hands-on the closer a household is to needing emergency services. So in terms of early stabilizers, 40% of all of our helpline callers are calling seeking general housing resources, not directly related to an eviction or homelessness emergency. Primarily, residents are asking for financial assistance, rental assistance, affordable housing opportunities, and relocation assistance. Given the constraints on financial supports, we have worked really hard with our partners to better identify what are the underlying barriers that are driving these needs. So for example, a majority of the households that have fallen behind in rent are inquiring about rental assistance to avoid eviction. These households are noting a variety of intersecting economic shocks and barriers, primarily related to loss of income or loss of jobs. So we have really worked to strengthen our connections to these upstream resources. We have a really exciting new pilot where we are directly connecting residents that are calling upstream to Detroit at Work, which is our employment partner at the city, through data and technology so that we can make direct connection for those households that are experiencing that financial loss. I do want to note that the barriers captured in the graph are only for those where a direct resource referral is available. So residents are also reporting additional barriers such as change in household makeup, loss of income from other adults in the household, car accidents, and things of that nature. As we get to more mid-range resources, eviction prevention becomes really important. It is the second and the third most common cause of displacement identified by Detroiters that are seeking emergency assistance. So the city launched Right to Counsel in 2023, and this is a really valuable tool as Detroit has a very high rate of eviction filings for large cities. Just over half of all eligible tenants are now receiving full representation through through the program, and that's a significant increase. Prior to right to counsel, legal representation for tenants and landlord-tenant court were in single digits. So even if a tenant does receive representation, the circumstance of their individual case may not always guarantee that that household is able to stay in their unit. So to address these gaps, we have layered a series of interventions at different points in the eviction process. So one is we have streamlined connections to right to counsel. So we launched a pilot earlier this year where we have pre-screened residents that are in subsidized situations and transfer those households directly over to our legal partners. Early results from this pilot have showed increased rates of representation for households, decreased timeline for tenants connecting to counsel, and an increase in consent and positive judgments. We've also targeted limited rental assistance to these high-risk households. So the right to counsel providers that are providing legal representation in court are directly referring subsidized households that can retain possession of their unit with financial assistance over to our Detroit Housing Services office so that we can help those subsidized tenants remain where they are. So far, we've had over 180 subsidized households maintained through this resource referral. We also have our Detroit Housing Services Office, which provides relocation case management, so hands-on, one-on-one housing navigation for households that do have to relocate due to eviction displacement. As we get a little closer to proximity of homelessness, we really wanted to focus on non-leaseholders. So in a review of our coordinated entry and homelessness system, we found that 3/4 of all CAM callers had spent the prior night in a sheltered situation. Majority of these households were in non-lease situations, primarily doubled up with friends or family. So the prevalence of these non-leaseholder situations are not just limited to the most recent household location, but 58% of all callers, all families that were sent to CAM over the past year, stated that they were last stably housed in their own rental unit. However, only 25% of families lived in their own rental unit within their last 2 living situations. So this shows that not only are Detroit residents entering homelessness through non-leaseholder settings, but they tend to oscillate between a variety of these settings, often for extended periods of time before needing to access emergency services or emergency shelter. So we just talked about the importance of right to counsel and eviction prevention. But the city recognized that there is this gap in resources to non-leaseholder situations. So last month, we officially launched a new program called our Housing Stability Work. And this is a case management that is aimed at callers who are currently doubled up with minor children that are at imminent risk of homelessness, so loss of housing within 14 days. Each one of these households receives an in-person visit from a case management team and are provided with case management support to hopefully stabilize the household in that doubled up or diversion situation, or of course, connect to emergency shelter services if needed. We also know that we needed to invest more in terms of intervention for prevention at the point of homelessness. So we have layered a lot of early intervention and early prevention resources at the front door of homelessness, but many households are abruptly being displaced with minimal notice from these non-leaseholder situations, and majority of households have not sought out formal supports prior to needing emergency services. So knowing that through the data analysis that our first opportunity to directly assist residents may be at the point of emergency, we have undergone some system improvements to ensure that we are being responsive. So one, we have increased communication about our Detroit Housing Resource Helpline through coordinated communication campaigns. We've also extended the helpline to be 24 hours. So that way, if someone is experiencing housing emergency after kind of traditional business hours, there's someone who's answering the call and connection directly to street outreach to get households connected to emergency shelter or drop-in if they are experiencing unsheltered homelessness. We have also revised our coordinated entry process. We've kind of reduced administrative burdens and data collection so that the helpline specialist can really focus on having deep diversion conversations and individual problem solving conversations with households. And then we've also layered in a program called Rapid Shelter Exit. So for low acuity households, that may not be eligible for a resource such as a housing choice voucher or rapid rehousing, we still want to provide case management and relocation assistance to those households. So we really focused on expanding our upstream and our most intensive resources for our system. And so I just want to give a quick shout out to the GPL as we've been working with them since 2023. We know that funding is going to be changing and will shift over time. And so we've been really thinking deeply about the residents we're serving and the data we are able to identify to ensure that we are pairing the right resource and right intervention to households that are most at risk and need this support. And so we really appreciate the research and understanding that we have been able to do with the GPL. Thank you.
Great. Thank you so much, Chelsea, Julie, and Irene. Really interesting to sort of hear how communities in the Bay Area and Detroit are both thinking about layering resources and targeting, but sort of slightly different approaches, slightly different sets of resources. We want to jump into some of the more in the weeds questions that are coming through the chat and about prevention tactics. But first, want to sort of pull back for a moment to acknowledge the moment we're in for homeless response broadly. We know there have been recent changes to the HUD-NOFO that impact permanent supportive housing funding, and there are a lot of communities that are concerned about reductions in federal resources. So in this environment, curious to hear from both of you how, whether these changes, potential changes to federal funding, whether that's going to have an impact on prevention, and more broadly, why and how should communities continue to prioritize prevention in this context? So I'll maybe throw it to Detroit first.
Thank you. So I think one of the things this department, the Housing and Revitalization Department that Chelsea and I both work in, one of the things that we do in addition to providing the housing stability work that Chelsea was discussing is we invest in affordable housing as well. And I think so from my vantage point and seeing especially both sides of the business that we operate in this department is just the cost efficiency of these early interventions, especially as we have worked through different iterations of this program to try to reduce our costs, make sure that our dollars are being as efficiently used as possible and that we're able to utilize them for as long as possible. We've really see a lot of cost savings compared to how much it costs to be investing both in new development, which is of course incredibly important, but for people that are unhoused, the amount of resources that those resources it takes to serve those households. So if I can, right, if I have the different resources that can do different things, then I want to make sure that I'm not increasing the flow into something where I know I already don't have enough money. So for us, it's just a cost-effective approach, and it works with the different resources that I have that some can do one thing, some can do another thing. And so how do I layer them on to provide this level of services? So for us, it still continues to be, will continue to be a part of our approach.
Irene, any reflections?
Yeah, thank you for the question. And, we're obviously differently positioned in that we aren't managing the actual programs, but we are really involved with tracking the impacts across the Bay Area. And, anytime we see constraint on one part of our system, like prevention is related to permanent housing, is related to interim housing. And, anytime we impose more constraint on the system, it's going to be a challenge. Um, our program, all of the programs that I mentioned are funded through a combination of philanthropic and public investment. And as I'm sure many people on the call are well aware of, there aren't great ongoing funding sources right now for prevention work. And so adding this constraint to our system anywhere is going to make it more difficult to free up flexible dollars for things like prevention. So we definitely see a constraint there. I also just want to touch on in the Bay Area as well as is in the country, homelessness is highly racialized, and race is a huge predictive factor in the Bay Area for who is at risk of homelessness and who's entering our system. And beyond the constraints imposed by the NOFO on we don't know what's happening still, but beyond the constraints on permanent supportive housing, we're very concerned with the effects that a lot of the other pieces of policy that are part of that are going to have on our ability to um, address racial disparities, serve people who are undocumented, provide gender affirming services, and really just continue with housing first priorities. So that's kind of a global concern in addition to the funding constraint that we anticipate, getting worse.
I'll maybe ask just a follow up there because I know a question that we often get is about like how can we fund these services?
Yeah.
So if either of you, if either Detroit or Irene, if either of you have any sort of perspective to add about how to create funding for homelessness prevention or where the funding comes from for your services, which I know you touched on, but if there's anything else you'd like to add there.
Yeah, I can just continue on that a little bit and then maybe we go back to Detroit. So, in the way that All Home has kind of helped catalyze more of these programs throughout the region is providing kind of startup grants, basically. So, we fundraise for a pool of funds that then we provide startup grants to cities and counties that are, willing and able and ready to do these programs with often matching investment from wherever possible, other philanthropic or other kind of other models. We have a few other kind of financial assistance models in the Bay Area that we're kind of trying to get all of us to row in the same direction on what those funds are, with the goal of having our public agencies, if not fully fund, at least be able to give a fair amount of contribution. So, for example, the city of Oakland started primarily using private dollars with a little bit of public investment, and now it's nearly all public investment with a little bit of private dollars. So as we're able to demonstrate impact and especially we've had a few of our counties successfully put local measures on the ballot that can raise funds, and in a couple locations that's one of the sources. So for example, in San Francisco, they have a measure that generates revenue that they're able to use. But that's not true everywhere. It's a huge luxury to have, and not every one of our counties has that. So ongoing struggle.
And I think for Detroit, there's some context here that I think is important, is that we are currently going through a mayoral transition that starts in full effect on January 1. So certainly that means that priorities are evolving, and I think that that's an important word here, because I think for what the incoming mayor and incoming administration has definitely signaled that they want to really even increase the focus on the type of work that Chelsea was describing in detail. So what we've done is recognizing that a lot of the resources that we've been using are limited in terms of their time limited, is how are we've done some pretty extensive budgeting work and how we are going to evolve into this new system. And it's going to also require us to look at what are we going to be able to continue to serve the same populations that we are serving now, or were we going to have to prioritize the households based on the different situations that they come into um, our network? So we really have looked at what can $1 do? What are the regulations that dollar can do? We're using city general fund dollars. Those can do certain things. I have other dollars from right now, they're all federal resources, but we are having discussions with philanthropy about some dollars that do need to be more flexible, that that city dollars can't really be used for. I know there is some research being done into new revenue sources for the city of Detroit, but that will be certainly up to our new administration and how they want to move those things forward. So for us, it's really been a lot about kind of puzzle piece alignment and the kind of extensive work around that, and to try to make these dollars stretch as far and as kind of well aligned as possible.
Chelsea, anything you want to add? Okay. Well, I'll just follow this thread for a minute. In our registration questions, we asked folks about what was happening in their communities, and a few folks responded saying like they're currently setting up new homelessness prevention programs. So I'd love to take a minute to hear from you all about like what advice would you offer for communities that are maybe just getting started and want to expand the way they think about homelessness prevention. Maybe they have diversion right now, maybe, some diversion program. How would you advise them, or what insights would you give them to help them get started?
So I can start with this one. I think we've seen a lot of success in our paid diversion programming. So we offer small stipends to basically diversion advocates, right? So that may be friends or families that households are staying with. We have seen, right? Of course, if there's more households, more individuals, more residents living in a house, costs go up, right? Groceries go up, light bills go up, water bills go up, and so being able to provide that small offset has had a really positive effect on being able for households to stay in that diversion, that doubled up situation longer, to give us more time to provide relocation case management. We've also kind of extended some of our services to the diversion advocate. So they might be looking for new employment or new jobs. And so that also helps to reduce some of the interpersonal conflict that was referenced, right? And because there can be tension. And so that's been really successful for our team doing the in-person home visits so we can really connect, build that level of trust in terms of case management. And then divergent advocates see, right, the household is reaching out for help, they're receiving assistance. So it kind of puts and pulls some pressure off of the timelines that were previously communicated in terms of needing to find an alternative living and situation and arrangement.
That's really cool to hear about. I love being on these panels because you get to hear what other, I'm learning here too about all of these things. So it's great to hear about this. Um, kind of a different tack to this question. A big thing that we have tried to really champion as part of our work is grounding the risk factors and how we assess people's risk of homelessness, like who gets the services in an objective set of criteria and threshold. A lot of our programs that we're doing financial assistance or even during ERAP, during the emergency rental assistance program, it was basically more first come, first serve. And it's a philosophical, as in addition to practical shift that we've actually found to be more difficult than we anticipated. Um, because it's very hard to be saying no to a lot of people who do have real needs. They do need support. There's no question that financial assistance would make their lives easier, but they might not be at quite the brink of experiencing homelessness. And so I'd say if you're really focused, as this program is, on preventing unsheltered homelessness, just such a big issue in the Bay Area, then like really grounding whoever is making your decisions in that type of mentality. And that's again where it's important to be very aware of what other programs you're going to be offering, what other types of services are available for people who don't meet those risk criteria. But that has been kind of an important, like, early and ongoing thing that we grapple with. And what that's looked like is I saw some questions in the chat on research. We have based our work really on, there's a really fantastic evaluation of destination homes work in Santa Clara County. There's the California survey of people experiencing homelessness, CASPA, that came out of UCSF, that really talks about these risk factors. And then we brought together a working group of experts from across the Bay Area, so that not only were we hearing different perspectives, the perspectives of people with lived experience, but we were also getting buy-in from folks. And that's how we developed our tool. And so making sure that whatever objective criteria you're using are both evidence-based, but then also are bringing in your local partners and making sure it doesn't feel like, because it will at some point feel top down. Like, that's how providers report back. They're like, this decision is made not by me, by the tool, and that can be a shift. So just sharing that as kind of one, it both requires more conversations, and yeah, it's difficult, but possible. Um, yeah.
I appreciate
So,
that, Ruby. Julia, anything to add?
yeah, I'll try to be quick here. So in Detroit, and Detroit is homelessness looks different here than it does in the Bay Area, but it it looks different than other places, but there's of course similarities as well. But one of the things that I've observed in the last few years is that we homelessness is and and housing instability, they're complex issues that I think maybe it they seem clear to at up front, but there's so much more to them, and so there's so much more layers to the services that are provided and the connection to those services. Where we launched programs that were more maybe politically driven than us having an opportunity to really identify outcomes at the beginning, it maybe kind of directed us towards uh, an alignment of resources that wasn't necessarily the kind of response that the data would lead us to if we were using a data and outcome based approach that we would have chosen. And so I think in the last couple of years we've spent a lot of time really trying to get our 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 cons our stakeholders that are not providers, but that want to be involved and want to be engaged in it, trying to really work together to build a broader set of knowledge, so that as we're evaluating what are the programs that we want to deliver with whatever the limited resources that we have, so that it's that we're having kind of more in-depth conversations than a like you need to put more beds in place. Well, I can no matter how many beds we have, we're going to fill them. We've got to reduce inflow into into those beds for so many different reasons. So I think I would recommend making sure to invest the time in really increasing the knowledge and getting everybody on as equal playing field, so that you can have those really productive discussions about what the right interventions are for your community.
That's great. And yeah, I feel like in Detroit, you're connected to so many different nonprofits and you have so many different sort of groups that you're connecting folks to, and that I know requires a lot of sort of setup. So in both of your presentations, you talked or at least mentioned eviction prevention within your spectrums, right? And for All Home, it was on the spectrum on the right side. It's not really the focus of the targeted homelessness prevention program, but it was there. In Detroit, you all spoke a little bit about the pilot that you've been running for subsidized households. I think a big question in the field is what is the relationship between eviction prevention and homelessness prevention? And by preventing evictions, are you preventing homelessness? And I'm curious, sort of, what are the perspectives that each of you bring to that? And what might you be missing if you're only tackling evictions? I don't know. Chelsea, do you want to kick us off?
Yeah, I think our partnerships with our legal service providers are really, really critical. I think we see from the data that 14% of callers to CAM have gone through an eviction, and we also see from the data that I showed that a lot of households are able to have family and friend and social supports prior to needing emergency shelter. And so I think it is a really important tool. It's one of the important tools in homelessness prevention. It's not the only one, and I think that we have been really intentional in Detroit to work really closely with our legal service providers. So this kind of work started in our eviction diversion days that was state funded, and then ERAP, noticing right that we can't do this work alone, and we have to have strong coordination. And so I think that the pilot we have in terms of referrals from the helpline to legal services and then back show just the tight coordination and the layered resource approach that is really needed. So it takes a lot of convening work, takes a lot of meeting work, but I think bringing those resources together have a really positive impact on homelessness prevention.
Yeah, I can speak to the Bay Area a little bit. And, it's different across every city and county. City and County of San Francisco, for example, have the right to counsel and a pretty robust network of legal service providers. Other jurisdictions have one provider. So in terms of just access to legal services, that can look really different depending on what part of the Bay Area you're in. In my prior role, I focused a lot on eviction prevention, and so I thought a lot about this. But I think in terms of I feel like it's like a Venn diagram of like not everyone who's evicted is going to become homeless, and not everybody who is, at risk of homelessness. A large proportion of people who are at risk of homelessness, maybe they had an eviction a while back that destabilized their housing situation further. But the point that they're about to be outside is because, they've lost home sharing option, or there's some other incident. So there's just, it's a really important connection to have, and then to be able to have that legal service partnership, as I mentioned. But, there's also a dynamic in California where there's very little time to access services once someone's been served with an eviction notice. And so even if someone does reach out, and this kind of gets to, I see some questions in the chat around like how people are finding services and what we can do to find them in advance. And this is a challenge because if someone's already facing an eviction, there can be very little time to provide support if it's available. So, but really important connection. It's one of the legal services broadly are one of the pieces we have involved in the program. And it just based on capacity, it does look more robust in some counties.
I pick up from that question in the chat that you started to answer. Anything else or anything that you all want to share from Detroit about how you can sort of like find folks upstream who are at risk of homelessness, and what that looks like?
Yeah, so as Julie mentioned, the helpline number was actually the number that we utilized during ERAP, right? And so we spent a lot of time with the 36th District Court, and we have a really robust legal service provider network in the city of Detroit. We're really fortunate that there's many nonprofit providers that do this work. So during that time, the court sent out a notice with all summons around the number, around the helpline. We did a lot of intentional community outreach to nonprofit groups, to direct place-based social service providers, as well as elected officials. And so we spend a lot of time and attention attending community meetings, promoting the information, and really kind of encouraging the messaging, like call early and call often, like please call as soon as you may need resources, so we can start to connect residents to some of those later touch upstream prevention resources. So just a lot of communication, a lot of outreach work. We also look at the data and see where are callers not calling from, right? So are there specific city council districts? Are there specific neighborhoods where we're seeing a low call volume? And then we're really intentional to work with those nonprofits, with those city council members, elected officials, to really target communication and outreach to those areas where we're seeing a lower volume. So really making some data driven decisions there as well in terms of outreach.
Great. Okay, I'm sort of sprinkling in audience questions, but one more that I will ask that I know, again, in the registration questions, lots of folks were asking about how you think about measuring the success of these programs. Irene, you mentioned in your comments that, you wouldn't necessarily expect 100% success. What's challenging about measuring success around homelessness prevention, and how do you think about it?
Yeah, at All Home we have 85% a goal of 85% of our clients staying housed at the 6-month and 12-month mark, and that's kind of the most basic piece that we measure. And again, that's a reflection of if people are at really high risk, like the assistance they receive may not be enough to keep them housed in that long term. I will say this is another area where we run into a lot of challenge with folks responding at the 6 to 12-month mark. And so it can be challenging doing kind of these more informal evaluative activities because responsiveness is huge. But I did mention, some of the more, there was an RCT, a randomized control trial done in Santa Clara County, and then also in Oakland. I don't think I mentioned that one. And then All Home is currently working on a causal evaluation of our work with the California Policy Lab. So having these kind of like big E evaluations to look at is also really important to be able to demonstrate both the need. So I see a question also about demonstrating the sustainability piece and like if people are at kind of too high risk to benefit from our work. And that's something that has come up in those evaluations that has been really useful. And I think we can also see in some of our data in terms of like people do figure out a way to stay housed, even if it seems like they won't. So that's kind of one piece of measuring our impact. And then this is unfortunately, we still have to be fundraising. So I have to say, like, stories are still really important for helping motivate both our partners we need to get funding from, as well as it really speaks to a lot of local elected officials as well. Having those stories, it can be very persuasive. So we do also have some qualitative data collection that we do to try to kind of capture some of that impact on a more human level. Um, we can think in very much like numbers, which it can be a problem, but it's also how we're trying to assess that. Like, if the thing we care most about is reducing unsheltered homelessness right now, which isn't, I wouldn't say is the thing we care most about, but it's very important in the Bay Area as a priority. So that is one of the things that we really are trying to measure, that longer term impact.
Chelsea or Julie, anything you want to share there?
So we've been really fortunate, as I mentioned in the presentation, to have support from GPL for some of this evaluation. So we're a newer program, right? The helpline and the housing services office launched in 2023. So we are doing some of this analysis now. I think there's some counterfactuals and some gaps in terms of residents who may experience housing instability post-resource that may not like be in HMIS because they're not enrolled into an emergency shelter program. And so we're not always capturing 100% of the full story just through the data. And so those qualitative evaluations are really important. We see similar things in terms of response rate. The further we get away from providing a service, we kind of see some of the response rates decrease over time, but we are focusing on pairing helpline call data to DHS program enrollment data to HMIS data so we can understand the impacts of our work and what has been most impactful to reduce residents and Detroiters' housing insecurity and homelessness.
Okay, well, speaking of data matching, that leads us to another question from the chat, which was about how you might be leveraging AI or other technology tools, data in homelessness prevention. Will share in the chat. We did have a webinar featuring Janie Roundtree from the California Policy Lab to talk about the approach that they're taking in Los Angeles with the homelessness prevention unit. But would love to hear how you all think about like the potential of AI in this space, or just more generally using data and matching data systems and technology. Irene, do you want to kick us off?
Yeah, I'm glad to hear you mention Janie Roundtree's work and the work of CPL in LA. It's very exciting, and I've gotten to hear them speak about it, and it's really cool. I do think while like I would love for us to be able to do that type of work in the Bay Area, it requires pretty unified data systems and pretty sophisticated administrative data sets. So for folks who don't know what we're talking about, basically LA has been able to use administrative data sets to create predictive models for who appears to be at the highest risk of homelessness and then proactively reach out. I see we have folks from LA here, so you can explain it better than me. But in essence, that's what it's doing. I think there's opportunity for other places to do that. However, having a city and a county be the same thing really helps. So we have a lot of counties in the Bay with lots of different cities. It can be really hard to do that data matching. We are trying to make sure that our HMIS systems in our counties gets more integrated with our prevention platform. One of the downsides of our platform is that it's not, in some jurisdictions it is, but it is not unified with HMIS in all of our jurisdictions. So that's another really important thing for us to be working toward. Santa Clara County it is, they are linked. So that's one of our data goals. And then this isn't AI, but I think that this idea of kind of predictively reaching out to folks who appear to be at risk is there's ways to do it that are not using AI. So we're working with a group of youth service providers in San Francisco on principles for a youth homelessness prevention plan in San Francisco and talking about how providers can be proactively screening young people. A lot of our young people who are at risk of homelessness interact with a lot of systems. And if there's an opportunity to add risk assessment and offer services proactively before they're, this is another kind of more upstream intervention. There's a lot of ways that we can probably incorporate prevention services into existing risk assessments or existing service points for young people. So I'll offer that too.
Great. Well, we just have, Chelsea, do you want to comment?
We're really early in some of these conversations. I think, we are learning from various research and reports that have been done, having some conversations with the state. We know through research, right, one predictive indicator is loss of benefit, specifically food support through SNAP. And so we're in really early conversations, but we have really great partners at the Michigan Department of Health and Human Services. And so we're in some ongoing conversation around data sharing and being able to reach out to households at early intervention points, learning some lessons from other research from other jurisdictions.
Okay, I will close us out with a question, a sort of big question, but it comes from a specific comment where someone shared that in Harris County, they've identified HUD funding that can be used to conduct a housing eviction and stability study. If you were leading a similar project, what types of findings, initiatives, recommendations would you like to see come from such a project? And I'll sort of just say bigger picture, like what type of research, what are big open questions for you? Where do you think more research is needed? What do you not know about prevention that you wish you did? What sorts of questions could a study address?
I can go. I think, I'm not, I need to know more about what you're planning to do, but I'll just say one thing that I would love to have more on is we do have, I've heard of variation in terms of how robust service offerings are with the direct financial assistance across not just the Bay Area, but the country. And I would love to know more about what the impact of those additional services are. For example, if we're thinking about folks who may be unemployed, like connection to employment services, like I consider those to be very important parts of our program offering. Or, if someone's housing is far too expensive for them to sustain, helping them find new housing. But that requires quite a bit of additional services and like, humans doing jobs that costs money. And so I'd be curious to know comparatively if you just provided someone the financial assistance versus the suite of services, like what difference and impact that has, and kind of how critical those additional services are to helping folks stabilize. So I don't know if that fits into the model that you're doing in Texas, but excited to hear more about what you work on.
Chelsea, Julie, any questions you want to leave us with for the researchers and those students in the room to think about?
I was just finding that question in the Q&A because it had some details I wanted to make sure I looked at. I think for us, what has been interesting is we've been doing a lot of data collection on the households we're providing services to. Is there We've been trying to look at what their long-term pathway into our um, our services network and system has been. And Chelsea was mentioning some of the uh, predictive indicators that we're starting to identify. But I think for us, kind of being able to really track how people are coming into a situation where they need or they're reaching out for assistance has been um, useful in terms of it also seeing how it has been changing during the course of our data collection. So if I agree that I would love a little bit more information to be super helpful here, but I would be trying to identify some longitudinal learnings of how people are entering into a point where they're reaching out for services, not only in terms of length of data collection, but also looking back at a household's history to the extent that you can gather that information.
Great. Well, we are at time, but I want to take a moment to thank Chelsea, Irene, and Julie. Thank you so much for joining us and for sharing your wisdom and sharing what's happening in Detroit and in the Bay Area. And thank you all so much for joining. And we will have the recording available for anyone who wasn't able to join.
Thank you. And feel free to reach out to me by email. I know there's a lot of questions we didn't get to. So happy to answer more if folks reach out.
Absolutely. Thanks, everyone.